Welcome to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness throughout your journey in life. Your host is Dr. Emran, a respected physician who's treated thousands of people just like you over the past 10 years. Listen to the show each week on iTunes, iHeartRadio, Spreaker, and 3 and Out Radio Network. Information provided on this show is not a substitute for professional medical advice. Always discuss your questions with your doctor or go to your nearest emergency room immediately.
Thank you so much for joining me today on Simple Health Radio. I'm your host, Dr. Emran. On today's episode, we have a very special guest. She is a world-renowned orthopedic specialist. She actually specializes in pediatric orthopedic surgery as well as sports medicine. She is also on the board of directors at the American Academy of Orthopedic Surgeons, and she has published dozens of research papers across the United States and worldwide. So with great pleasure, we would like to introduce Dr. Jennifer Weiss.
Thank you so much for having me. That introduction makes me feel very proud of myself.
Wonderful. Very good. Well, we are very pleased that you made time in your busy schedule to join us today. I was looking through some of your online profiles, and you are in a very unique category, I have to say, as a pioneering female in the pediatric orthopedic industry. There are several statistics that really stood out to me, and one of them was about the 6% figure. So tell me a little bit about that 6%.
Yeah, so orthopedic surgery is one of the last bastions of male-dominated medicine. And what's interesting is over the last year, we finally hit that number. I'm sure you're aware and your listeners are aware that the graduates of medical classes are going to be slightly a higher percentage of women than men, which is amazing. So we'll have more women, or at least equal, if not more women in medicine as physicians than men. However, there's some fields, as everybody knows, that continue to be really male-dominated. And I learned as I was doing some research a few years ago that it is more likely for a woman to want to be a neurosurgeon and even a urologist than an orthopedic surgeon. One of the amazing things about what I do is the pediatric orthopedic community is actually growing our women at a faster rate than the overall orthopedic community. So I am very proud of us as pediatric orthopedists, and what we're trying to do is learn lessons from the pediatric orthopedic community to bring to the greater orthopedic community to emulate this success that we've had.
Wow, that's truly fascinating. I was not aware of that statistic, honestly, before I had a chance to review some of your information. So I will say that generally when we walk through hospitals and we see the surgical schedule, it is male-dominated, but I didn't realize it was 94% male.
Yes, and a good piece of news on this front is that the trainees, so the orthopedic residents, are coming up in numbers. So we are predicted to get to a better place, but it's not fast enough. And in the boardroom at the Orthopedic Academy, as well as orthopedists in the front line, everybody's really spinning our wheels about how can we move things faster. And we think that learning lessons from other fields, it's so important to have women to mentor women and to have young women who are coming up into choosing, am I going to be a physician? Am I going to be a surgeon? Wow, am I going to be an orthopedic surgeon? Is there someone that looks like me? Is there someone who acts like me? Is there someone who has the life that I want to have outside of medicine that I can imagine myself in that role? And I think that we are getting more vocal and more transparent in terms of mentoring and role modeling, not just what we do as orthopedic surgeons, but also what we do with our families and how you can be a mom if you choose to be and be an orthopedic surgeon. And I think that's held us back for some time.
Absolutely. No, I agree with you on that. And you and I were talking off air about some of the unique challenges, and you had mentioned some phrases on your blog as well, the recent one that you posted, and you used 3 vocabulary words that I had not seen before. One was called code shifting, another one was shapeshifter, and another was chameleon. So this was actually something that you published recently, and I, as a medical doctor, I had not seen that term used before. Tell us a little bit about what those words mean to you.
So I have to shout out 2 people who have were part of the discussion to bring this to light and to drive me to write about this recently. So one is a dermatologist named Christina Kim, who is at Permanente with me, and another is a woman named Tammy Hughes, who is the president of the Heim Group. And both of them were discussing this phenomenon. And what it means is that we as people walking into different environments all have different aspects of our personality that we bring to the forefront and amplify perhaps in different surroundings. But I think most of us, at least I, for much of my life and career, was doing this on a subconscious level, understanding now, for instance, I am in the kitchen with my family. I'm not allowed to ask somebody to pass the knife. I'm not allowed to assume that somebody is going to burn. I'm not allowed to, make a lot of assumptions, whereas I'm in when I have to shift myself to the leader and the no nonsense because there's somebody who's asleep who's relying on me to fix them. So these different personalities that we have to bring out. And as women, what we're starting to find is that women interacting with women versus women interacting with men, we're going to be successful in different ways with our communication skills with different audiences. And so for me, for some lucky reason, some of this comes naturally to me. One of the things that we're learning about is that for men to be comfortable and successful with one another, they have to be able to happily banter with one another and perhaps poke at one another. And for me, this comes very naturally. I had an older brother. I was an athlete. My dad was an orthopedic surgeon. I grew up in this way. However, for some women, that feels really weird and that feels kind of nasty. And so if they try to kind of step into that bantering role, they don't feel comfortable or themselves. So these things that I'm starting to recognize about myself that have made me feel comfortable in a room full of men without even realizing it.
No, that's a very unique perspective. I truly had not heard of this type of vocabulary used in that sense, but it makes a lot of logic, I guess, the way you describe it, in that when you leave the hospital, you're in the home. When you leave the home, you're in the school. When you leave the school, you're in a different public event, and not everybody knows who you are. And I saw that you had mentioned you also have children, and yet every night you do make it home for dinner. And so I was struck by the fact that you highlighted on the point of efficiency. And especially as a female provider, efficiency, I think, is one of your motivating factors to get through your day.
Yes. I will say when I first had my first child, I was working at Children's Hospital Los Angeles. And it's a wonderful organization and institution, and they had and still have a daycare on site. And so my child was there. She was physically there, and at the end of my day, if I lollygagged or meandered through the end of my day, I still could kind of walk back and forth to see her and come back to work, and that was a really unique, amazing thing. That is no longer in my life. My children have their own lives. My youngest is now going into first grade. I have 3 children. And so, yes, the efficiency of being able to say, I need to compartmentalize my day, being a surgeon, but guess what? My day, and I'm all surgeon when I'm being a surgeon, but my surgeon day has to end at X time so I can get to whether it's a dance recital or a baseball game or the dinner table or what have you. And I've actually become really transparent with the people I work with about that. And I chose a shift in my career to work with Kaiser Permanente because of that ability to be very predictable and to say, you know what, my last appointment is at X time. If the patient cannot, keep to a certain time, they have a grace period of whatever time. If they're late, unfortunately, they will be seen by somebody else, or they can be seen by me the next day because I have to get here for my children or my family. And that's not taboo anymore. That's actually okay. People like that. My patients actually respect that and like that. I don't keep that from them either.
And I was recently reading one of your press releases. You were in USA Today, and you talked about 2 questions that families, patients actually have when they should be selecting a pediatric orthopedic surgeon. And the 2 questions, they made sense, but they were also very complicated. So I'm going to read those off if that's okay. The first question that you suggested is, does your orthopedic surgeon have experience with the injury or condition that your child has? And the second question was, is your orthopedic surgeon's office comfortable taking care of the children in your child's age group? And that was highlighted in this article on U.S. News and World Report. I'm sorry, I misspoke. It was U.S. News and World Report. But I was glad that you brought those 2 points up. Can you tell me a little bit about those conversations, either before the patient comes to see you or when the patient and the family are actually there, how you sort of guide or how you instill confidence in that patient and that family, because this is a very complex pediatric orthopedic issue?
Yeah, thank you for bringing that up. I think that is that is really important, not just in orthopedics, but I think in medicine these days in general. So there are some, as orthopedic surgeons in our country, in the U.S., to graduate from residency, to be proficient, and to maintain your competency, most people maintain some care of children. For residency, you have to have at least 6 months of training with kids. Now, that's not going to make anybody an expert on everything. There are certain bread and butter injuries that everybody helps to treat, simple fractures in children, and sometimes even simple operative surgical fractures in children are really part of most orthopedic surgeons' repertoire. However, we are living in a world really as people begin to subspecialize and uber subspecialize. We have a joke in orthopedics that not only will people subspecialize in knee surgery, but they will subspecialize in like knee replacements of only the left knees.
Sure. Yeah.
It's crazy. So I think as we're starting to subspecialize, what we need to understand as patients is, am I in the right place? And have they done this surgery? Is this part of their routine? Are they happy and comfortable to do this? And is their team happy and comfortable? And how will my child feel in these surroundings? So even if the surgeon is happy and comfortable, what does the nursing team feel about taking care of kids? Do the orthopedic technicians know how to talk to children and their families? Or are they used to writing school notes? All of these things are important pieces that are everyday pieces to pediatric specialists that adult specialists, may not be so in touch with.
Absolutely. No, I agree with you. And as you mentioned, I think your team is really what makes you successful. And it starts at the front, with your front desk, with your nursing staff, and it goes all the way to the back end, your anesthesiologist, your post-surgical care, wound care. All of those team members are so important. Now tell me, in the future, where do you see yourself in the next 2 years, 5 years, 10 years? Because you've accomplished so much in such a tremendous, field that you have. What would be your goal that you would set for yourself? And how would you make that a reality in the coming years?
Oh, you're so kind to ask that. It's ironic because I'm spending some time with my best friend this week, and she actually asked me that today. And if she hadn't, I think I would be perhaps a little bit more at a loss. So I'm glad she and I had this conversation. I am hoping to spread my experience and knowledge, not just within the world of orthopedic surgery, but I would really like to play a role in women up and into orthopedic surgery and feel comfortable in medicine in general. So my passion at this time is really mentoring women in medicine and also making women who want to have families feel like this is not taboo. Should be a transparent part of who we are, and really being able to celebrate this. So I'm hoping to turn my blog into a book within the next 2 years and get that out there.
Wonderful, wonderful. Well, please allow us to book you once your book is out so that we can be one of the first radio stations to promote that, because it's been such an honor just discussing these topics with you. You really provided some insight that before I really didn't focus on. So I really appreciate you making time from your schedule to speaking with us about that today.
Thank you so much for having me. It's been a pleasure.
Absolutely. Do you have any final thoughts, any last comments that you would like to pass on to our listeners across the country?
I'd love for people to hear more from me on Twitter, Instagram at My Mom the Surgeon.
Okay, very good. And I will also shout out your website as well. It's jenniferweissmd.com. Our episode will be recorded and available on iTunes, Spreaker, as well as iHeartRadio. And I'll be sure that we include all of your social media profiles on there as well. And that way people can connect with you on Twitter and other websites as well. Those of us joining us today, thank you so much to Dr. Jennifer Weiss, who made time to speak with us today about her role as a very prominent pediatric orthopedic specialist. She's also a mother. She's also a family person. She's published a number of research articles. I do hope that our listeners will have a chance to connect with her online and hopefully in person at one of her future events. So again, thank you so much, Dr. Weiss, for being a guest. You've been listening to Simple Health Radio with Dr. Emran, and I do hope to have you on a future episode.